Hello and welcome to Maternal Mental Health Awareness Week, where this year we are marking 10 years and our theme is A Decade of Voices. And my name is Eve Canavan. I'm one of the co-founders of the week. And for our information session today, I'm delighted to be joined by our friends from the Asian Miscarriage Hub. And with that, I'll hand over them to introduce themselves. Hello,
Hi Eve, how are you?
I'm all right. How are you?
I'm good, thanks.
Lovely.
I'm Asiya Dawood. I'm the founder of Asian Miscarriage Hub and the founder of South Asian Baby Loss Awareness Week, which was launched last year. And I work predominantly raising the stigma and taboo around miscarriages in our community. I'm also a public speaker and an advocate for our community.
Wonderful. And they're saying, I see just won a brilliant award last week that we were just talking about. And I am thrilled. I am thrilled that you've been recognised for the work that you're doing. And I genuinely mean that because I think over the year, I spend going through who we should talk to in the awareness week to highlight people and organisations, and particularly organisations that have been born from lived experience.
Mm.
And I thought could think of nothing better than to have you on for this week talking about the work that you do and to highlight the work that you do, but also to celebrate the passion behind it. And I was so pleased when I saw you win your award last week, and it is so rightfully deserved. And so, yeah, I wanted to say well done to you.
Thank you.
It's just so lovely. It's just so lovely, and I just think this is such a great space to highlight the work that people are doing that has come born from lived experience. And I think the your initiatives that you've kicked off have a real passion behind it. And I think if people go over to Asian Miscarriage Hub and see the work that you do. And there's great stuff on it about the work that you cover, but also your personal profile, and the fact that you
Mm.
do your public speaking and you go around sharing experience and the work of the organisation. I think it is only right. And I feel like we have on the platform that we do here for the Awareness Week. I see us as the vehicle, as someone who doesn't offer services ourselves, I see us as the vehicle to highlight the extraordinary work of other organisations who support people, which is why I'm really delighted that you're here today.
Thank you.
Oh no, I'm thrilled. Right, so before we go into a chat, I'll do the disclaimer that I do at the start of all of these information sessions, which is today our conversation is purely for information purposes only. Anything that we discuss today, we are not healthcare professionals, so anything that we do discuss should not replace any individual information that you have from your own healthcare professional, be your GP, your midwife, your health visitor, might be with the perinatal mental health team, you might have a consultant. Their information is sacred to you, so please use stay for information purposes only. Right, okay, let's go into it. Asian Miscarriage Hub, what is it? When did it start? And why did you start it?
So Asian Miscarriage Hub came about, I'd say nearly 5 years ago now when I had my daughter. She's now 6. And it came about after my miscarriages. I had 4 miscarriages before I had her. And I decided to create a space for our community to support women and couples and men who go through miscarriage, where a topic like this is seen as such a big taboo, a stigma. And it was just a safe space that was provided for them. And also to tackle the toxicity surrounding all of these talks and words around our culture and society. And then that came about. And then last year, I launched South Asian Baby Loss Awareness Week. I'm the first person to ever launch that in the UK, which is a dedicated space for South Asians for baby loss. I know we have a Baby Loss Awareness Week as a whole on in October, but just like Black Baby Loss Awareness Week, South Asian Baby Loss Awareness Week is also just as important, just to cover the cultural side of things and how people are more comfortable sometimes talking to people from the same culture, from the same religion, and if you're the same color. I just found that it was a gap in the society that definitely needed to be filled, and someone had to do it, and that was me.
And you know what? I think such kudos to you because I think I always thought really informally, on these sessions. To me, I would say, I've been in this space a really long time. I was poorly after I had my son, 16 years ago, and I had a substantial amount of losses before Joe came along. And for me, I am learning so much from you. And I say from midwife Alicia, who runs Black Baby Loss Awareness Week, who we've covered in the week, and whose week follows this week. It is so
Amazing.
important, exactly, and it is so important for women and families at home to feel that their voice and their situation is being represented
Mm,
specifically, but also for healthcare professionals. And
Yeah.
that's why these talks are really important. So we can signpost healthcare professionals who are watching at home, because we know we've got a big platform here at the Awareness Week. It's really important for us that for healthcare professionals at home watching this to know that a resource like yours exists, to know that the
Yeah.
Miscarriage Hub exists, and to know there's a specific week actually that supports South Asian families who are encountering baby loss, and that signposts into resources and support. So I think absolute kudos to you as well for founding and launching something and realizing there is a real need for it, because you don't just launch something and create it. It is your blood, sweat, and tears that is
Yeah,
behind it.
it
You're
is.
not paid for any of this, as much like the work we do here. This is from your passion. This is from your passion, also. And I just think it's a real kudos to you that you're working full time, which I completely understand. This is it's people call it side work, but it's not, because it's your
It's
passion,
not. Yeah, yeah.
and you're giving all of this and yourself to support other families, within the community that you
Hmm.
understand. And I think it is so important, and it's a real genuine. I learn, and I've said this to you because we've been talking for so long. I learn so much when I talk to families that come to us to say, where can we access resources? We've gone through
Yeah,
loads from a South Asian community, and I say, go over to Asian Miscarriage Hub. Actually, there's an awareness week that was launched last year. There's
yeah,
information and support, and I'll send them links over. And I just think the work that you do is fantastic at giving families a voice. From what I say, and from what I'm learning, I think it's really important to say, like, we need to continue to learn how we can serve people better. Like, to say where we do signpost people to, where there are organisations that can support them. And I think we hear so much, particularly where families feel that they are not listened to, like they are not
mm,
represented. And I just think the work that you do, like off your own back, to make sure that families are aware of the support that's available to them, and that people are listening and paying attention to them, and that they
yeah.
do matter. To me, I just think the work you do is fantastic. I think it's brilliant. I think you're
Thank you.
wonderful. But it's
Thanks.
so true. No, it's true. And
Thank you.
I think when I started doing this work around postpartum psychosis, I was like, no one knows what it is. No one knows what a mother and baby in it is. So that's when I went
Yeah,
on my rampage 16 years ago. And it was needed, and there's
yeah,
still so much work to do there. But you know, then I think, but look at all the other things that we're not paying attention to, and look what needs a light shining on. I think every day when you open your inbox, and you'll get far more of this. You'll get people saying, I was spoken to in a certain way in hospital. People said there was
yeah,
no support groups for me.
yeah,
You know,
yeah.
there was interpreting services, all these kind of things.
Yeah.
You
It's
just think people
they're
feel
just
so alone.
misunderstood. So many are misunderstood.
Yeah,
And it's
I
just
think
about
completely.
providing that space for them where someone actually understands them.
So what with the Asian Miscarriage Hub then, do you provide, let me hand it over to you. What kind of stuff do you do? Do you have forums, safe spaces, support groups? What do you
So
do?
yeah, I run a support group, which is just a free WhatsApp support group. I don't really there's nothing much on there. It's just about building that community of women who've been through loss and just need that support on a daily basis. So I run that, and it's more about just providing a safe space. Asian Miscarriage Hub is just a safe space where I tackle a lot of the stigmas and the taboos that I talk about, and it's from my own experience. I do signpost a lot of women to like charities and things because I'm not a registered charity. I'm just Asian Miscarriage Hub really. But I do signpost to a lot of charities, and yeah, I'm just that brown person trying to make that change really.
But what a change you're making. As I say, I
Yeah.
feel like I'm learning so much from you. And I think one of the things that I wanted to ask you, because quite often we get when we do these information sessions, is like, the people that you're speaking to, do they go out to the NHS, larger organisations, and do you kind of, inform them of the work that they're doing? Is that something that you offer? Do you go out to the NHS, large organisations, charities to talk about the work of Asian Miscarriage Hub, or indeed to inform and educate?
I do volunteer with like the major charities. So I'm volunteering with Tommy's, Sands, and Miscarriage Association. So they are well aware of my work, and then we just work together to kind of bring the changes that we need and whatever is needed for the community. So NHS I haven't really tackled yet. I would love to like kind of tackle the NHS and the disparities that we see in there when it comes to black and brown maternal health. But we're getting there slowly. I just haven't approached anyone in the NHS yet.
Well, I wanted to talk about kind of bereavement care, so we talk about miscarriage, and unfortunately so many of us will experience loss. The stats that, are so high. I think it's 1 in 3 people will
Yeah,
experience, miscarriage as a whole. And one of the things that, I read about and I've learned about so much is around like the need for culturally sensitive care, and particularly in bereavement care. And it's one of
100%.
the things I've been really learning from you. And I just wanted to open it up for you to kind of talk about the importance of that.
I think when it comes to like bereavement care after loss, it's really, like you said, it's really important to understand the culture because as a brown person living, as a British brown person, we come with our culture no matter what. And when I went into hospital and I was, having a miscarriage, it was really hard to describe to the doctors about culturally what we do. And, it's about educating GPs as well, or the medical staff about how to treat someone who is from another culture and how to take it into importance of how to do that. I'm so sorry.
That's fine.
Um, but yeah, bereavement care, there's a lot of things that culturally are done. For example, for us, it's like, taking care of your body afterwards, eating certain foods, where and going to certain places. There's so many things that we do. For a Black person, it might be different. An Afro-Caribbean person, it might be different. So it's just about understanding culturally, but also like religion. Like there's lots of different things that people will cover religiously as well. Like some will have a cremation for their baby, some will have burials, and it's important for medical staff to understand that as well.
And you know what? I think I mentioned this to you ages ago when I was messaging you on Instagram. I can remember it in my head, but I think it was months ago. I can remember being on a Facebook group for healthcare professionals. I'm on so many of them, I can't remember which one it was. And someone was saying, um, how do I speak to black or brown women about how they want us to support them as a healthcare professional with their loss? And I think, God, I'm sure I can't remember how I put it in a message, but I was like, why don't people just ask people first of all how they would like to
Yeah,
be supported? It
yeah,
sounds really basic, but if you're a healthcare professional and you're thinking, okay, I'm navigating loss, I'm navigating loss with a South Asian family, and I want to make sure that I'm doing best by them, and I'm not quite sure what to do. Where does a healthcare professional who isn't culturally competent in that area, where do they seek advice? What's the best place for them to start? What should they do?
so Tommy's baby loss charity and Sands baby loss charity actually have a dedicated team for the South Asian community. So Tommy's has a South Asian midwife as well, and Sands has a dedicated South Asian bereavement lead. So, it's you can just contact them. You can just contact Sands or contact Tommy's and say, look, I've got this couple, I don't know how to deal with them. What advice can you give me? It's as simple as that. It's just about reaching out to the right people and seeing what help or advice you can get. So they have their dedicated um South Asian leads.
And just also, I was going to ask you, sometimes people, like, I think the thing I got from seeing that thing in the group is that people seemed frightened to ask, to be like, I don't know how
Yeah,
to support people.
yeah,
And so, and like, I guess I wanted to ask you, it's more than okay for a healthcare professional supporting somebody in a space that they don't understand to say, how can I help you? That's
yeah,
okay, isn't it?
yeah, 100%. There's no shame in it. There's no shame in asking, how can I help someone? Because like I said, we're all learning. Every culture, every religion's different. We don't know culturally. We know people, but we don't know their culture. So it's just about learning and being able to provide that support for them because it will help you in the future anyway.
Absolutely. I think when I was thinking about my dad passed away in October, and how we celebrated his death was so different to when my friend's father passed away in a Hindu funeral, and the differences, but the beauty behind it, and learning about why certain things were done and our
Yeah,
inclusion in the
yeah.
service. And it felt such a great space to be able to ask questions as to why, and also what
Hmm.
we do to support the family. And I think it is safe. It is completely okay to say, what do I do? How can I help you? And I think this is the kind of conversation where we can talk about that, to say it is all right to have those conversations and to say, I'm
Yeah,
not an expert, but how can I support you? But I think one of the reasons I want to talk about that is that I think I'm really grateful for the work over the last few years that has highlighted the things we are not grateful for, which is that we know that black and brown women especially are not listened to in
Yeah.
situations, so I talk about very much about when I was poorly after I had my son, um, how I felt not listened to, and how when I had a number of my miscarriages, how I was in the early pregnancy unit in the same room
Mm-hmm.
that on the same room that women were scanned in, walking out with their pregnancy scan. I was walking out
Mm.
being told I'd experienced the loss, and I talk about that. However, talking to my black and brown friends and organisations that support black and brown women and families in similar scenarios, one of the things that I've massively learned is that level of not feeling heard is
Yeah.
hugely
Yeah.
increased. And I've learned that anecdotally, but also actually clinically in a research way in the work that we do in the space
Yeah.
that
Yeah.
we're in. And I am really aware of how people in your communities feel either silenced or feel not listened to. And I think
Yeah.
around loss, this is nuts.
Yeah.
And like, so what do we do? And I think so much work has been done over the last couple of years, but still we are hearing that women do not feel listened
Yeah.
to. And
Yeah.
I think when they're experiencing the pain of a loss, what would you say to somebody in the South Asian community who's experiencing loss and doesn't feel listened to by healthcare professionals or in a healthcare setting? And and what can they do to say, I don't feel listened to and that you're not listening to my pain?
Yeah. I think the best thing to do once again is to contact Tommy's or Sam's because they do have dedicated people to
Sure.
actually listen to you and probably signpost you further. If your GP is not listening, charities like this have people who they can signpost you to. They have trained professionals, like Tommy's only hires midwives and they will be able to listen to you, and then signpost you further on. I think just don't stop. I think when we get to a point where you know that you're not going to be listened to, it's like, oh, what's the point?
Yeah.
Yeah, I think it's about not stopping and just keep advocating and saying, no, I'm not being listened to. But what I find is that a lot of the time women just stop and say, well, no one's going to listen to us anyway, so what's the point?
Is that what happens?
Mm,
But then they're alone with their pain
yeah, but it's
and
quite
then they
common because
struggle.
they're just fundamentally trained like that. Like, it's okay, don't worry about it. It happens to so many of us, all of that happens. But what my thing is, like, for me now, when I speak to women, I keep telling them, don't stop, like, keep advocating for yourself.
Yeah,
It's time to change that, and if you're not being heard, go to the second person, go to a charity, go to someone like that who will signpost you further and will listen.
absolutely. And I would say one of the things that we've learned over this week, we've talked to quite a few GPs over the last week, is what I've been saying to them, that if somebody goes to a healthcare professional and doesn't get the response that they would like to move them on to the next stage, that is absolutely okay to say, I want to talk to somebody else.
Yeah.
I want to talk to somebody else. And
I
that is
want, I think just even saying, I want you to refer me to a specialist.
okay.
Yeah, just refer me.
And
I
the
know
thing of
that they
advocating for
don't.
yourself.
Yeah. Be like,
There
I
was
want
something
to
that you
see
said there
someone.
to me. Sorry, carry on, go.
No, no, go on. I'm done.
No, I was just going to say that you something you said there when people say, this is something that go through, try again. I think
Yeah.
that's that awful thing you hear when you experience
Oh, you'll have another.
you'll have another, or if you've got one already, and
Yeah.
they go, but you're so blessed to have one, and that
One.
minimizes the pain so much. And I think it's that thing of when you are from a large family,
Yeah.
and there is you want to have more, that feeling of someone saying it to you, that minimizes that pain so much by just saying, try again. And like you
Yeah.
talked out in the
It's just
beginning,
so easy to say, I'll just try again. But how long do you know I've been trying for?
and the pain of loss is awful.
Yeah.
It's
And what do you know about me trying? Like, I could have been trying for a year, nothing's happened.
what do you say
Yeah.
to people about how to handle those kind of conversations? So if someone says to a family, I mean, especially in your community, because this is what we're talking about, if to say,
Mm.
actually we've had a miscarriage, and if people are saying, well, try for another one or just try again and almost minimize the pain, what do you say to that person?
I've become quite brutal. I
Okay.
think I think my journey's made me like that. And I think like with me, if they say to me, try for another, I'll be like, okay, how do you know I'm not trying? Or I will just turn around and say, no, actually, I'm happy with one. And then it's kind of like, but why are you happy with one? It's like, because it's my choice.
Yeah.
And that kind of like, throws them.
I'll tell you the awful thing is because I've just got one, and when I say to people, like the amount of losses I had before Joe, and then people go, oh,
Yeah,
they go, oh, and
yeah,
so but then I say, well, I'm happy with my one now, and then people do that awful thing where they go, oh, they've got to have a brother or a
yeah,
sister,
yeah.
they can't be
It's
on
so
their
important for
own.
them to have a sibling. Yeah.
But I've definitely learned from my son, and this is talking about as loss as a whole. I say to my boy, that I've joined a Facebook group years and years ago when he was about 4, when I was kind of coming to terms that I was going to be like probably be child of any, like a parent to one child, and I'm like, for me, I'm really content now. But it was a journey to get there. I joined a group called something like my first, my last, my everything, and I that that's what for me in my situation, that's what I say. But I still now. I went to some market research weeks ago where I was trying out like a hair straightener or something, and the woman in reception was like, "So, have you got any kids?" I said, "Yeah, I've got one. How old? 16. Oh, doing his GCSEs? Yeah." And she went, "Didn't fancy any more?" And I thought, what a question.
Yeah. It's just so casual, isn't it?
Yeah, I was like, what a question. Where can I begin? And I said, no, I did try, and it, kind of didn't work out. And then, and it was like, doesn't he get lonely? And I just thought, I don't know who
Oh,
you are.
yeah. Why should I give you all this information?
But it is,
God, people are just so intrusive and rude. Like they feel the need to
it's
ask all
rude,
these
isn't it?
personal questions. It's like, what's it got to do with you? Just get on with my hair.
Yeah, no, I'm with you. I felt for the first time in a really long time, I'm very open like you, but I just thought, goodness, I don't even know what your name
It
is, and
takes
you're
you
kind
back,
of.
doesn't it? It takes you back a bit. Like, excuse me? Like, who are you?
Yeah, no. And I
Yeah.
think I've really learned that through the work that you do, so and I really mean it. Like I do before I interview people, I make sure that I've been following their work for a really long time, but I also make sure that it's work that we've learned from here at the partnership, and I make sure that I do my research into what you do and the work that you do and how you support families and the information you put out there. And I found the Baby Loss Awareness Week to be really helpful
Mm,
in terms of, and that's why I'm asking the questions that I ask, because these are the kind of things that you touched on around the things that people say to you, how
yeah.
you handle those awkward conversations at massive family gatherings, when people are like, still no baby number 2 yet, or
Yeah, yeah,
don't you want to give them a brother or a sister, or
yeah,
we'd love to be grandparents.
yeah. Oh God, it just doesn't stop me. It doesn't stop, I'm telling
Is the
you.
grandparents thing a big thing? Does that come up a lot?
I haven't seen that, no.
Yeah, no.
It
I
might
think I often
be,
say this with loss.
yeah, it might come up rarely, but no, not that much.
Yeah. I was
No.
looking at some work we did with like worst girl gang and stuff around loss, and I think there's lots of questions that come up around
Yeah,
family, what family members say, what teachers say, are people aching to be grandparents, this, that, and the other. And
yeah,
it is that it's making that space and asking the questions of, have you ever had things come up in what you work in? There's any
yeah.
information we can share. And I think that's why these kind of, chats are kind of so important that we get it, that we get it out there. And I think actually that's brought me on to my next kind of thing, because I know you do lots of public speaking. You've got the
Mm.
awareness week. You talk about the work that you do with other organisations. With the work of Asian Miscarriage Hub, what is next for you and for your organisation? What is it you're going to be doing?
I haven't really thought that far ahead. I take it each day as it comes, to be honest. I mean, my main focus was obviously to provide a safe space, which has been provided.
Yeah.
And then it is to kind of, and then South Asian Baby Loss Awareness Week came. So my focus is that now and just providing that for the community and just to build on that. And just to grow Asian Miscarriage Hub as a brand and as me, really, and just to give that space that is so desperately needed out there.
And it
Even though change is coming, but it's not coming fast enough, and women are still struggling within our community. And that's what it is. It's just that safe space for them.
If people want to join your WhatsApp group that you talked about, because I want to make
Yeah.
sure that we're able to signposting, and we're recording this, so I'll put all this in the caption below, because obviously
Yeah.
this wanted to be a open, friendly, informal chat. We want to make sure
Yeah.
that all the information, and we'll put that in the caption below. If people want to get in contact with you and want to join the WhatsApp group, how are they
hmm
able to do that?
So just go on my Instagram, drop me a DM, and then I'll probably ask you a couple of questions because I need to make sure that,
Yeah,
sometimes you have to be. And
yeah.
then, yeah, and then I'll just send you the WhatsApp link.
Lovely. Absolutely.
Yeah.
Safety and boundaries, it's what we talk about,
Yeah.
So I think anytime people join any kind of peer support, there are safety and boundaries conversations, however big or
Yeah.
small at the beginning, to make sure that you're letting people into a safe space. So
Yeah.
absolutely, that's an expectation. So we will put all those details in the caption below. And just I know you don't know this, but I'm going to ask you. Just tell people, what was the award that you just won?
No, stop it. It was
What was
oh
it?
my
Was it
God.
was it like Agent of Change or something? What was it? Tell me
No,
what it
it was
was.
glass ceiling breaker.
There you go. See, that's ceiling breaker because that's what you are. And I know you don't like talking about it, but I'm going to talk about it.
Yeah, I'm not
You,
very good at it. I'm just like, yeah, it's an award.
no, but you should be really proud of what you've done. And I know I talk about this, but I mean it. In this space, you're doing this totally for free, off your own time, with your own experience. And we talk about this loads. Talking about your own experience can be really emotionally taxing
Yeah,
anyway. But to
yeah,
then decide to use that purely for the good of others, purely to say, so to give other
yeah,
people a better experience and to be able to have and to enable people like me to be able to have really open conversations to be like, how do we have conversations to make things culturally
yeah,
appropriate? What do people say when I'm not sure where to go? How can we support
yeah,
families in the
yeah,
South Asian space because we're not doing it as good as we should be? Like these conversations are really important, and you are giving your time and your expertise and your lived experience for free in a
yeah.
space where it's really needed. So that's why I wanted to celebrate the fact that you got your award because that's really
Thank
important.
you.
It's really
Thank
important.
you.
But I found today to be really helpful, and I think loads of people who are watching will. We have been asked to cover this in our survey. So most of the things that we're covering this year have been brought up in the survey that we do every year. So,
Okay.
I hope the people that's come up, that this has helped people with that. And all the information will be in the caption below. This video will be available on our Grid Forevermore, and it will be on the Grid for Asian Miscarriage Hub as well as a collaborator on the post. And we'll put the
Thank
details about
you.
how you can join the WhatsApp group in the caption. But yeah, it just leaves me to say thank you very much and for all the work
Thank
that
you
you
for
do.
having me.
No, it's been a pleasure. Lots of love, okay?
All right.
Bye
Take
bye.
care. Bye.